Digital is such an important enabler for new models of care that the local digital roadmaps are going to be so important in building a framework that can really help us to deliver paper-free at the point of care in 2020.
The process of arriving at digital footprints has really helped people to think who their partners are and where the majority of their patients are cared for the majority of their care. What that process has meant is that people have had to talk to one another to say, do we have a joint set of aims and ambitions around the digital agenda, and then agree that they do. That in itself is huge benefit.
I like the graphical idea of a roadmap, because a lot of times I've had to take a business case in pictures to a board or a storyboard. This is a great analogy, and the roadmaps I have seen, the good ones I have seen, and certainly the Bradford one or the Bristol one, they all bring words to life in a different way.
Interoperable working is within the social care field. I think sometimes we forget that it's not just around the social care record, it's about being able to share that record with key players in the independent sector and the third sector as well. And certainly as we build these roadmaps, it should be our ambition to involve those areas as well, because mainly we commission services from that sector. They play a huge role in people's care. I'm hopeful that the process and the move towards a paper-free environment by 2020 is pulling local authorities and other parts of the system closer together.
We've got one care record now that we share between the local authority, community providers, mental health providers, secondary care and primary care. Just joining up by those few providers and those few high-risk population, we've managed to reduce emergency admissions by over 20% in 2 years. So I think that just shows you the sorts of benefits you can have if you start taking interoperability to the next level.
I don't think people realise how big Greater Manchester is. 2.8 million residents. We've got 12 CCGs, we've got 10 local authorities, we've got 15 acute community mental health provider organisations. Bringing those 37 organisations together just to agree that that footprint was the first challenge, and we seem to have everybody on board.
I think the digital maturity assessment for me has also helped a lot, because it's allowed us to get that benchmark to feed into the roadmaps.
So we're a digitally immature trust. I think that it has massive potential to improve patient care, patient safety, flow through the hospital. IT is not a luxury, it is an essential requirement to patient care, and the staff are crying out for changes to happen. Whenever we've implemented IT in the past at this trust, which has been clinically led, it has been fully embraced.
So I see the roadmap to paper-free by 2020 as being an extension of work we've already done. I think we'll be sharing data with patients online and helping them look after themselves at home or in their communities. I think we'll also then have a fully interoperable solution for working with other providers.
Tell me a bit about the innovation work that you've been doing.
We've been doing a pilot with one of the clinicians whereby patients are actually uploading their blood pressure and heart respiratory rate and stuff within an application, which then can be fed into our EPR, and that's actually patients taking responsibility of their care in their own home.
We're very lucky. There's very little remnants of paper that we have. Some of them we have to have because of the way the system is at the moment, but the aim is to ultimately become completely paperless. But I would say we're 98% paperless. With other multidisciplinary teams, we can access notes from A&E. We have radiological scans on the system. We have PACS system, and CRS merges everything together. We have a system called EPR, which is patient letters that go to GPs and GPs respond. These are scanned in, and we're able to view scanned documents from GPs making initial referrals and also making initial consultations. And if we do refer, we can refer internally using the system. For example, if somebody needs a psychiatric assessment for a mental health review, we're able to use the computer to make that referral.
So at a very human level, just this morning, literally, I've received some tweets from local GPs commending the system and with real excitement in their ability to see the data that the hospital is providing.
There was one weekend when I was on call and the whole IT system was down and we had to revert back to the old system using paper, and using phone calls to do all the referrals and to do all the requests for everything. And you just realise that how much the technology saves you every day, and that you take it for granted.